Welcome, welcome, welcome. Since you can hear me this time, thank you so much for still staying there while I was muted, right? So I can already hear the jokes now. But my name is Dr. Roch, owner of the Maryland Spine Institute, MSI Integrative Healthcare. We've got two locations, one in Harford County, one in Baltimore County. Thank you so much for dealing with me with my technical difficulties, but we're going to have an exciting show tonight. We're talking about mental health. We've got great experts. It's a topic that I know pretty much very little to nothing about, right? So that's why I have three experts instead of two. And what I want you to do is hopefully during that time while I was muted, you were sharing this with your friends and family, and you could start a watch party, or at least just tag a couple of your friends in the comments, right? So at least they can share it on the information too. So without further ado, I just want to let you know a little bit more about why I started this Facebook group. The Facebook group was created because over the past year, I realized that there was so many people that were not getting sound, good healthcare advice from good, sound healthcare professionals. So why not ask people with licenses behind their name, people that have studied, people that are actually treating in the arena that you have issues with, right? So the first session that we did was on chiropractic. The second one was women's health, children's health. So feel free to go back and watch those on YouTube. I guarantee I'm not muted on those. And this time we are actually dealing with mental health, which is a topic that everybody should be somewhat either familiar with, or if not, be touched by in some type of way. So without further ado, let's introduce our expert panelists. The first one is Mr. Dion Brown. Dion Brown is an LCPC and an LCADC. He's a clinical therapist with DJB Therapeutic Solutions. Welcome, my good friend and brother, also a youth pastor at my church, Mr. Dion Brown. Welcome, welcome, welcome. The next person that we have is Miss Kelly Rogan. Miss Kelly Rogan, the initials behind her name, credentials, I'm sorry, behind her name are LGPC, right? She's a licensed counselor with Kelly Rogan LLC. And Miss Kelly Rogan, I actually know her. I met her through Joyce, right? So Joyce, when she used to work at Towson University, that is my wife. For those who's wondering who's Joyce, Joyce worked at Towson University for a good bit, and Miss Kelly works a lot with the students and young adults there, and they've been going through a lot over this past year, and still going through as we've been going into the fall. So maybe we have some young adults that could ask her some questions as well. Welcome, Miss Kelly, right? And last but not least, we have a very good friend of mine, also my frat brother, Dr. James Tisdale, PhD. Dr. James Tisdale is a licensed clinical counselor. He works at Johns Hopkins University. He's been a member of Phi Beta Sigma for probably plus 20 years, Phi Beta Sigma fraternity, and he is working at Johns Hopkins University, and then also, I believe, at Franklin Square as well. So welcome, Dr. Tisdale. Please welcome, and thank you so much. All right. So I'm glad everybody can hear me now. So what I'm going to do is I'm just going to go ahead and get started. Mr. Dion, I'm going to start with you, and I just want you, all in in some type of way to just please explain the credentials behind your name, because many people that might be looking at this, they may have never even been to or thought about seeing a mental health therapist, right? So what are the credentials behind your name? What's your specialty areas of focus, and the typical types of patients and problems that you deal with?
Sure. So I am Dion Brown, a licensed clinical professional counselor, licensed clinical addictions counselor. So at the master's level in the state of Maryland, as well as a number of other states, we can become licensed in professional counseling. So that's what you see with the LCPC. The other initials, the LCADC, that is a specialty license in addictions as well. Concerning my practice and my areas of expertise, definitely have to deal with a lot with mood disorders, anxiety, life decisions, adjustments, transitions, of course, issues related to trauma, certainly race-based trauma, and just a plethora of different things. In addition, I tend to specialize with integration with mental health and spirituality for some of my clients that want to integrate the two. My practice really has no barriers in the sense that I work with everyone. So there's no limitations in generally in the population of people that I see. I do have a large pool of particularly African American men who are coming to grips with therapy and therapeutic issues, maybe the first time in their life. So I carefully walk with them and kind of guide them and hold their hand and endorse their emotions and release of that. But my practice, again, ranges from generally ages 11 to 65. I sublet 3 office locations in the DMV, one in Baltimore, one in downtown Silver Springs, as well as Upper Marlboro, Maryland. So that's enough about me.
That's all right, man. I want to be like you. Look at that. That is awesome. That is awesome. That is so great to hear, Dion. The next question is coming to you, but I'm going to pose that same question to Kelly and Dr. Tisdale. So, Kelly, what are the letters behind your name? So, Mr. Dion explained his. Just what's your background, your credentials, and what's your typical client?
Sure. So thanks so much for having me. My letters are the precursor to the LCPC. So I'm a licensed graduate professional counselor, which means I'm licensed in Maryland to practice under supervision. There's a lot of training that goes into becoming a therapist to make sure that we're practicing ethically and responsibly. And so there's a training portion where I can practice as long as I'm working under someone who is fully licensed. So that's where I am. Like you said, I work with college students.
Wow. Hey, real quick, Kelly.
Yeah.
Hey, Kelly, real quick. How long does that process take, by the way, just in case there's somebody that's on the provider side that says, hey, maybe I want to become a mental therapist. So just walk us through that real quick, because you're in the graduate program before you get to the LCPC, right? So
Yeah,
how long does that typically take?
Yeah, so you finish your actual schooling, so the graduate program, and then it's 3,000 hours of supervised work. So it can take as short as 3 years. It can take as long as you need to get there.
Wow.
It's a process, but it's a process that I really appreciate, because I want to know that the providers that I'm seeing personally have good training and have good support. And I think in the mental health world, we're listening all day, and we need someone to kind of guide us in how we're dealing with everything that we're hearing. So there's that training process is really important.
Yes. Well, that's awesome. That is awesome. Well, you have one fan already. I see Joyce Harrell saying you are awesome. So you've got one person in your fan club already, Kelly. All righty. So my brother, Dr. James Tisdale, PhD. I know that's a whole lot more schooling. That's all I know, right? So please explain the credentials behind your name, typical patients that you deal with, and we'll go from there.
Absolutely. Can you guys hear me? Can you hear me?
We hear you perfect.
Perfect. Again, my name is Dr. James Lee Tisdale Jr. My credential is at LCADC. I am a licensed clinical alcohol and drug clinician. I also have CRC, which is Certified Rehabilitation Counseling. I've been in the field for over 19 years, so that means it's been a long time. I'm giving my age away, but I started out, in complete substance abuse. It was years ago, but in that particular field, I realized that it was more to give, and it wasn't just fit into a box. So it brought on different opportunities. I work with drug court, but by day, I'm a special needs coordinator administrator at Johns Hopkins, which means I authorize duly diagnosed levels of care that can be integrated throughout Center for Addiction Pregnancy. It can be, basically somatic care, where substance abuse to a certain extent or mental health trump the medical related concerns. So that's what I deal with. And the scope in my private practice is more court order care, which means transition care, transition back into the community. Let's bring some balance to what's really going on that address those biopsychosocial factors that play a key role. So that's just a bite of what I do. But drug court care can range from youth all the way up into age 99, to be honest. You know what I mean? Because a lot of people that's court ordered to care, DWIs, etc. But that's my scope. It is person-centered care. So that's just the way that in a nutshell. But that'd be the pieces of me. Absolutely.
That's awesome. That's awesome. That's awesome. All right. So back to Dion. So Dion, and I'll start off with this because this is a realm that I'm not too familiar with. So I think I just want to start off as a clinician, as a doctor. I know that like when patients come to see me, sometimes pain can be a very big motivator to get up and do something about your situation because many people do not like being in pain. So me as a chiropractor, I'll have friends and family call me from New York saying, "Hey, can I drop down to Maryland because I'm in pain?" Right? So what are the indicators? Because I don't think and this is just me from the outside looking in, but many people, just like they do with some, I see, as he said, somatic, which is muscle, right? For those that don't know, somatic is synonymous with muscle. So people with musculoskeletal pain, they'll have pain, but they'll try to work through it, and they'll just keep working until the pain really stops, and then they're looking for pain management, a chiropractor, physical therapist, something like that. So what are the indicators that people should look for to know that they or a family member needs to see a therapist?
Sure. So when we started talking about pain and pain management, it reminds me of the 10 years that I spent at Johns Hopkins at the main campus, working as a clinical therapist there. Periodically, from time to time, we had to do a physical pain assessment, but people were coming to see us in the psychiatric clinic. But it was universal. We had to do a physical pain assessment and rate their pain 0 to 10 and ask them how much pain, etc. Clinically, as far as psychological and mental health, whether you're the individual or you have a friend or family member that's in mental or emotional pain. Now, keep in mind there's a strong dichotomy between the mind and body. So a lot that happens in a person's mental space can affect them physically and vice versa. Now, in answer to your question, there's a term we often refer to as people's psychological vital signs, right? An individual's psychological vital signs. And when there's issues and concerns with these particular vital signs, which I'll mention in a minute, then this can be a clear indicator that something's wrong. So if there's a change in the person's a drastic change, for example, in a person's mood, whatever their normal mood space is, that can be an indicator that something's wrong. When we start to see changes in disturbances in a person's sleep cycle, their sleep pattern, how they're getting rest or not, changes in their appetite, their normal routine as far as what they would eat, as well as changes within their hygiene also. A person who is dealing with psychosocial depression or clinical depression may have trouble just with normal daily grooming. I have some high functioning clients who are doing very well on social economic status, but if they are off kilter as far as with their treatment, therapy, and or medication management, because of the level of the depression, for example, may struggle with even taking a bath every day. So those are some of the normal psychological things to definitely become aware of as far as eating, sleep, hygiene, exercise, mood, those typical psychological vital signs. If you notice significant changes within yourself or a friend or family member, then at that point, it might be advisable for them to seek out a licensed mental health professional.
Wow. And so there's something that you said that I just want to reiterate because I think that was powerful. You're saying it doesn't really matter what side of the socioeconomic scale that you're on. Like you have some high functioning, meaning they can be in a Brooks Brothers suit and a six-figure salary and all of that stuff, and still struggle with either mood disorder, sleep cycle, appetite, hygiene, things like that. Wow, that's awesome. Wow,
yeah, it doesn't matter.
Awesome.
It doesn't matter if you're an attorney or a student in high school.
Yeah.
No one is exempt from having mental health problems. When we talk, and I'll close with this, part. We're talking about mental health. It exists on a spectrum. And I tell people a lot of times when I'm doing talks that all of us have a level of mental health. And what is key is how we cope with the stressors in life that affect our mental health. So different stressors can impact all of us differently based upon the psychology of individual differences. So yeah, your status in life and who you are and your title and your degrees, that doesn't matter as far as your mental health when we're talking about the spectrum moving from mental health down toward mental illness.
Wow. That's awesome. That's awesome. So thank you so much. So those are some great indicators, like the vital signs and figuring out, okay, you know what, my family member or myself, I might need to get help. Like looking at those things just right there. So now, Kelly, I'm going to ask you a question. So, all right. So let's just say I see these Dion has spoken about. Now, how do I go about how does somebody go about finding or choosing a mental health therapist or counselor? And then also, can you just touch on not just, how do you find the one that's right for you, but also in terms of like payment strategies? Because many people might say, hey, look, well, is this, is this covered through insurance? Is it not covered? Does it depend on what type of therapist I see and all of that stuff, right? So if you can just touch on that and then kind of go from there.
Absolutely. So this is where the hard work comes, right? You're already not maybe feeling so great. And now you have to sort through, okay, do I use my insurance? How do I find someone? How do I find the right person? So it can get really overwhelming at times. So my first advice would be, if you have insurance, if you want to use your insurance, give them a call. Most insurance companies have a list of providers that are credentialed with them, and they can it gives you a place to start where you can kind of start picking through, okay, these people are in my area. And then there are websites like Psychology Today where you can look the people up, you can read what they say, you can see what they look like, you can see, maybe you're looking for someone that looks like you. So that's a really great place to start. Insurance can be finicky, and therapists are hit or miss with insurance. It's complicated in private practice. So you might find that a lot of therapists don't take insurance. Or you might find that you don't have insurance, or your insurance doesn't cover what you need. So there are low cost and affordable options that are out there. So there are two that I was going to mention just as resources for you all. There's Pro Bono Counseling Project in Maryland, which is a great resource for individuals who are underinsured or who aren't able to pay for therapy. And there's also a website called Open Path Collective, where therapists can post their information and they accept a certain number of sliding scale clients through there. So there are definitely options out there that make it affordable for you. So contacting your insurance, checking out these websites can be a really great place to start. Then it's about fit. So what are you looking for?
Yeah,
somebody who is dealing with addiction isn't going to want to see me because that's not my specialty and I'm not going to be able to serve you best. So really kind of picking through those bios of the therapists on the different websites. And most therapists offer like a free 15-minute consultation call. So you can call, you can chat them up, you can ask them all the hard questions that you're nervous about or what you want to know about them, and see if it's a good fit. We take calls all the time where we decide at the end of the call that it's not the right fit, but maybe we know someone, or maybe we can make a suggestion of something that you should look for to help you get that right fit. The other thing to remember is you might get a couple sessions in and then realize this isn't right. And that's okay too. You're not going to do the best work if you're not connected with the therapist. So,
yes,
taking the time to get through those initial hiccups and connecting with someone is worth it once you find the right person.
Absolutely.
And I'm gonna mute myself again. And it sounds like it's important, but I don't know how absolute it is. Like, does do I have to see a black male therapist that is like 40, 41, 42? Like, is it absolute? I guess is what I'm asking. That somebody is that somebody almost looks like the person, or can they get around that? Or does it depend on the actual person?
Yeah,
I would,
I think it
yeah,
depends.
I would definitely,
God.
I would definitely say it depends on the
Yeah, go ahead,
individual.
Kelly, and then oh, go ahead, go ahead,
Yes, I'm sorry, Kelly. Go
go ahead,
ahead. You
Dr.
go
James. Yeah,
first.
you can.
I would say the reason that it's beneficial to based on the individual is mainly because when we seek a therapist, we should be seeking someone that brings some alignment to us. You know what I mean? It's very important to look at the therapist's bio. Bios are very important when we're selecting a therapist. We want to make sure that someone is practicing cognitive behavior therapy. We want to make sure someone's practicing behavior therapy, or that has some kind of alliance. That's the benefit of all good therapists having a bio that's clear, to make sure that the member, or to make sure that the client is able to relate or choose. Is a choice. Just like when we go into the store, we
Yeah,
can choose and select a therapist that can meet our individualized needs, because no therapy situation is cookie cutter. This is is to be
yeah,
treated with, and I always share this, the same way that someone personal trainer would treat someone, to get that particular body straight, is the same way it would be different if someone would get their mind and those other factors that play straight. So it's very individualized, and it should be looked at individually. So that's just definitely
wow, that's
something that I always
awesome.
encourage, and I always share,
That's
to someone that's seeking me. I always say, you take 5 minutes to see if I'm the best for you. You know what I mean? Ask me
yeah,
those overreaching questions like, what is my background? What my degree is, and where did I school? All of these factors play to a productive session. So I always encourage that.
wow,
Let me chime in here also, because for me, transitioning from working for the Johns Hopkins, as well as a community center, into complete private practice for 3 years, it's a bit different for
yeah,
me since I run my practice full time. There is choice on the side of the patient and the therapist.
Absolutely.
I am contacted to an incredible degree every month for people looking for therapists. And sometimes I only have a few slots in a particular period of time. So I go through a system of kind of picking and choosing sometimes, which clients can I take in this month? I am actually in network with 5 insurance networks, and they're all private. I'm not connected to any of the state insurance networks on purpose, because of a lot of the challenges in the private sector. So all of the people that I see are generally, higher functioning people, students to professionals who have some sort of private insurance. Now, when they contact me, sometimes they don't know their plan. So I usually get their name, their date of birth, their insurance type, their member ID, and sometimes I have to say to them, "You have a $500 or $5,000 deductible that has to be met before your insurance will kick in. You can still see me, but you're going to have to pay out of pocket until then." So I find myself in the
yeah,
private sector walking people through, and a lot of people have said they had a difficult search, finding a African American male therapist, and for some of them, finding an African American male therapist who could integrate and possibly fuse spirituality together, whatever theirs is.
yeah,
And so
yeah,
it is a journey sometimes for clients. Last thing I'll say, I'm a part of a 735 member Black male therapist Facebook group across the nation. So what we do, particularly in the African American community, we will post daily in different states, referrals for people looking for a Black male therapist in particular states, because people generally don't know where to look. There are a few popular websites. I had 2 profiles on Psychology Today. I have my own website as well, but people generally don't know where to look for what they
yeah.
for what
I agree.
for what they are looking for.
Yeah,
Hmm.
and that's why I'm glad that Kelly gave some of those
Hmm.
resources earlier. But
Absolutely.
we have a question from the audience. Miss Karen, who's a nurse in the Harford County region, she says, "Do you see or have any of you heard of, and especially in light of what has happened over this past year,
Yes.
where mental health throughout all age groups and brackets, especially among the young adults, Kelly, so I'll probably chime you in as well. Have you heard of anything in terms of maybe like insurance coverage or insurance companies or even schools planning to do more with with creating more of a coverage for mental health therapy services? Kelly?
Yeah, so I mean, the one big thing that we're seeing is a shift to really allow telehealth, teletherapy. And I think that's the insurances kind of backing up and saying, okay, like this has been working, so let's see that. That just opens access for people who can't necessarily, you know, have the transportation to get to an appointment. I think that's going to be a huge change that hopefully will stick around. And then from the college side, you know, the young adults, I mean, huge efforts coming in to support. I mean, we're coming out of isolation. You know, we were in forced isolation, and now the anxiety of swinging back to like, nope, it's okay, go outside, you know, resume normal life. The supports have to be there. So it's a huge effort.
So with that said, and I don't want you to say where your school is not doing it, because I don't want to throw you under the bus, but let me just ask a broader question. Should schools, because I kind of posed this in that community health group, should schools, so most college campuses are like microcosms of society, right? They're just dealing with younger adults. So should schools already be hiring more mental health therapies, more mental health? Should they already be putting the resources in place, right? And do you see that happening across the board? I mean, there's like 20 colleges in 15 to 20 colleges in Baltimore. There's 15 to 20 in DC. So are you hearing that buzz? Like, are you seeing like the classifieds and schools calling for more therapists? Like, are you seeing any trends in that direction at all to prepare for the fall?
Yeah, so I mean, I yes to all of that. That is what should be happening. I am starting to see posts. There was a post today that I saw a community college was looking for more therapists. I think especially with the state schools, as the budgets unfreeze, that hopefully is what we'll be seeing.
Oh.
But it's a lot of moving parts. You know, it's not just we got to hire these people. It's expensive.
It is. Yeah.
It's complicated, but yeah, hopefully that's what we'll be seeing, is that they'll really be like beefing up that support.
Awesome. So Dr. Tisdale, I didn't pose a direct question to you, so I'll do this to you and then we'll open up the floor. So just to let you all know, if you're watching, please feel free to type in a question, send in a question. You can type it in. We'd love to hear from you. We'd love to get your feedback. So Dr. Tisdale, and then if anybody wants to chime in after Dr. Tisdale, that's fine. What are some of the biggest issues in mental health care fields right now? And why should they concern those in the general population? So the reason I asked that question is because many times people feel like, well, you know, that's their problem, right? People that have, you know, bipolar or substance abuse, you know, they have to pull themselves by their bootstraps and stuff like that, and they have to worry about that issue. So what are the issues? What are the major issues in the mental health care field today, right? And why should the general population, you know, concern ourselves about what's going on in mental health?
Absolutely. I would definitely say that the number one overreaching issue is the fact that is people that's being undertreated versus overtreated. That means that people are not even trying to get to their PCP, so the chances of them getting to a therapist can be almost scarce to none. And what I'm speaking to at this point, I'm speaking to the Medicaid population, which is a big population that we're talking about. I hear that we're talking about, even as a practitioner, you know, I mean, as a clinician, I can be credentialed through Optum, and, you know, which used to be value options, et cetera. But when we're talking about the Medicaid population, we can't even get people to go to follow up with their PCP. It's people that's not even, you know, going to the doctors when they positive for COVID. So we're talking about the mental health piece that can be underreaching or overreaching. It's just a place of mindfulness. So my goal, I mean, like when you asked that question, the answer to that question is just undertreated versus overtreated. I think that when we do have a problem, we go. Like when we got a headache, we go into the hospital. But when we're not sleeping at night and we're not eating right, like someone talked about hygiene, it become a normal situation. You know what I mean? Versus being over until it's a problem, until it's some court order, or until a major issue that reach you to that particular point. Everybody that got mental health issues don't go in homicidal or suicidal. You know what I mean? To a certain extent, everybody thinks that's what mental health look like. That's so by far the situation. We're talking about someone that have diabetes, that's depressed, that's not maintaining their blood sugar levels, that affecting that medical piece along with that mental piece. You know, we got a chaos. So it's just really, bringing like something like that word integration into these particular situations. But when we think about, how it's affecting, everybody knows somebody that got some underlying issues. You know what I mean? It can be someone, their spouse is, not eating well or overeating, or, very moody, angry edge, a trigger, anything that can trigger them. These are the things that we should look at when we're talking about a lot of kids. You're hearing a lot of kids with suicidal, ideations and suicidal issues. Everybody, and I always say when we're talking about mental health, hurt people usually hurt themselves to hurt someone else. You know what I mean? So that's just definitely something to think about when we think about that. When a child is hurting himself, it's hurting the parent. You get what I mean? Or the parent watching the child or the loved one go through these emotions and these roller coasters that's ups and downs. And all depressions don't look like ups and downs. And before we go, we think about when we're going through, like, that's where the substance abuse piece is called mood altering. A lot of people, may drink, guess that, the decrease and pick up a habit, and it becomes a substance abuse habit. We're doing it more than you should. So these are these factors, and you think about an alcoholic father or alcoholic mother. So these are these issues that are, that brings the family into a whole. So it's just, we must watch what we see, and we must be mindful of what's not being said that's being said.
Be very watchful. You know what? A lot of times, I can tell you used to talking, like health professionals, because somebody was just like, I think it was a Spin City ERs was like, hey, what is somebody's like, what is Optum? And me, I'm like, oh man, I deal with healthcare all the time, so I know Optum. Optum is it's an insurance provider, right? The United Healthcare, Optum, and that's one of the that's one of the health insurance providers or plans that you
for
can
the
be under.
Medicaid population.
So Kelly, and it is. You're right. So Kelly, I'll let you chime in as well. Like, what are some of the biggest, issues if Dr. Tisdale didn't jump in on them already? What are some of the major issues in mental health care today?
Yeah, so I mean, what I see with my young adult population is that there's still stigma. So a lot of times I'm seeing college students or young adults in private practice where it's the first time that they're sort of on their own and they're able to ask for that help. And so that's, I'm glad that they're finally able to do it, but we still struggle as a society of, acknowledging that mental health.
Why do you think so? Somebody just asked that same question that you're bringing up. So I'll let you kind of like dig in a little bit deeper. Why do you think, this is from Joyce, thank you, Joyce. Why do you think folks hesitate to seek help? Because truth be told, that's probably why somebody might have a question, but hesitating to type the question, right? Like, why do you think people hesitate to seek help, especially in mental health, Kelly?
Yeah, I think, it's sort of this, it's unknown, right? It's not like a blood test where you're like, okay, definitely anxiety, it's not so cut and dry. So I think there's sort of that mystery about it. I think some people might hesitate to seek help because they think, well, they're just gonna put me in the hospital and I'm gonna be I'm gonna lose control. And sort of go to those extremes, or what will my family think if, like, what does this label mean for me? And, there are different cultural expectations and thoughts about that. And so and there's lots of intersectionality. So you start building, all of these barriers, and it could be easier to just kind of suck it up and suffer on your own rather than risk, putting yourself out there, getting a label that maybe your family or your culture isn't going to accept. I think there's a lot of challenges with that, and the others can chime in with that too. Stigma is really challenging.
Yeah, the stigma. Mr. Dion, you can touch on that, but then also, what are some of the biggest issues in mental health care field right now that maybe you've been dealing with? Because I think you said you've dealt with a lot of people on an individual basis, and you've actually dealt with a lot of a broad age range as well. So you can touch on the stigma of mental health, and then also touch on what you think are some of the biggest topics and maybe untouched or untapped into issues in mental health.
Sure. I will say for a very long time, we've been dealing with stigma in reference to mental health and wellness. It does look like, with more awareness to mental health issues and, various celebrities coming forth in sports and television, media, et cetera, mentioning their mental health battles and struggles and various, foundations being started by popular people. It seems like we're turning the corner we have some work to do. We seem like we're turning the corner, but stigma. One of the signature talks that I do for companies, organizations, etc., has to deal with mental health, particularly in the Black community, and the challenges that go on. And I think there's a lot of reasons that I go into in that discussion, but a few of them are, stigma, being labeled. I don't want to be labeled. I tell my clients, I hate using this word. I hate it. I'm gonna say it, but I hate the crazy word because I think, because all of us have battles, we have struggles, we have challenges, we have things we have to cope with. So, and like I said earlier, mental health is a spectrum. So you're either coping well or something can hit your life where you're not coping too well. So that's another thing. There's cultural things that have been passed down. We have toxic messages that have been given to us by people. Some of them may be gender based. Another challenge can be sometimes a person's spiritual framework or background. So my clients, particularly that come from a broad array of spiritual backgrounds and foundations, when people first come see me, in school, we were trained to do a biopsychosocial, but I do a biopsychosocial spiritual. But I need to know my
So you know what?
Go ahead.
I'm gonna hit the pause button on you real quick, and then I'm gonna have you jump into the spiritual. But you already know where I'm going if you know. I'm a good man. Most some of my friends, my nickname is Pastor Roch or this and that, because I'm probably like one of the best God-fearing individuals that they know. That doesn't mean I'm a saint, right? But in the church realm, a lot of times, how can I put this? Because I actually dealt with this in my family not too long ago, where episodes and events that seem odd can just be thrown a spiritual label. And how should the church? Let me not ask it in a way that looks at the church in a negative light, because myself, in full disclosure, I am a Christian. But how should religious organizations, not just the church, but religious organizations, handle those issues where there might be a spiritual component, right? But there also might be a bipolar disorder, or there might be what Dr. Tisdale was talking about. There just might be somebody that has they're a coping alcoholic, and now all these other issues are going on, but yet they're spiritualizing it, and they're just easy. I think it's almost like a cop out to say, hey, it's just the devil, or it's just evil forces and evil spiritual aura that's messing up my energy and my chi and my flow, or whatever religion you ascribe to. So please, because you brought that up, touch on that, and then if anybody else wants to add in, but yeah, we just got a little deeper, but please touch on that.
So another, not to toot my own horn, but another one of my signature talks I do has to deal with it's called Mental Health and Spirituality, a Critical Collaboration. Okay. My good friend and brother in the city, Bishop Guy Robinson, wrote a book, and I have it. It's called A Critical Collaboration, actually. And it talks about, in reference to your question, it talks about a need for religious organizations, whatever the religious organization is. I want to make this very general for church, pastors, rabbis, imams, whatever, to connect with licensed clinical therapists, psychologists, social workers in the community, to form partnerships with people in the community. As well as to utilize the license credentials in your congregation, synagogue, etc. And so
Wow.
what is happening, you know, talking to several colleagues of mine who might, you know, if we look at for example, look at in a Judeo-Christian context, I know a number of my colleagues who that's where they identify, they are being utilized by their pastors or their religious leaders who will contact them and say, hey, I have a situation. I've been working with this person for about 4 sessions, but I think there's something deeper going on here, mentally and psychologically. Do you have space? Happened to me a whole lot. I get contacted by a lot of pastors. Do you have space possibly to see this person in your practice or do an evaluation? So that is starting to happen too. When we know better, we do better. So before it was only before it was only, you know, pray, just go to church, etc. And while those things may be okay and may have a place, I get in trouble for saying this a lot, but I'm gonna say it, and I say it on my platforms. You know, all of your needs are not going to be met from your religious community. All of your needs are not going to be met from your religious community. So just like it's normalized for us to see a PCP, you know, or an oncologist when we have cancer, or a special cardiologist when we have heart concerns, we
you know what?
Go ahead.
Yes. No. I was going to say, because I could actually relate to that even as a chiropractor, because there's some people where, and listen, like I said, and this is a great, I had no idea we were going this way, but that's why we call it community health conversations.
Absolutely.
So, because we talking like we're right in our living room, people, right? Because as a chiropractor, and you know, I didn't grow up in the church. I grew up in different denominations, Catholic, non-denominational, Christian, but sometimes people will spiritualize pain. And they'll pull up that scripture and say, oh, well, Paul said I got a thorn in my side. So if Paul got the thorn in his side, then I just got to deal with this pain. And this pain is in my chest. But I know it's God just working on me and doing something. But you might be having a heart attack, right? And you might be to see a cardiologist. You know, that pain down your leg may not be the devil. It might be sciatica, right? So I think that is something that I think if there's honest and candid discussions, right? Because there's a place for everything. And if there's honest and candid discussions, then yes, I think there is a detriment to just over spiritualize everything. In other words, just give a spiritual definition to everything going on. The same way how you can't really give a physical definition to everything going on. You can flip it vice versa as well. So Dr. James, did you want to chime in at all on that? Or Kelly, did you want to chime in on that at all? I'm sorry. Back to Dion and then James.
One little closing thing. That's why it's good to have trained people, like in a or religious context who can decipher and discern what's going on. But my last statement, in the words of one of my colleagues, Dr. Anita Phillips, she said that prayer is the weapon. Prayer is the weapon. It's not mine, Dr. Anita Phillips. Prayer is the weapon.
Don't steal it.
Prayer is the weapon. Therapy is the strategy.
Absolutely.
I like. Prayer is the weapon. Therapy is the strategy.
Dr.
I
Anita
like
Phillips.
that.
Dr.
Anita, thank you so much. Dr. James, what were you going to say? And we'll go to Kelly.
I was great. Say I definitely agree, and I tell people all the time, like a lot of people view church as a hospital, and the reality is that's why they have a hospital, you know, with specialty and specialty providers.
Yes.
And I always share, like, if I'm sick and I got a cold, I need to see a cold doctor. You know, I mean, we think about, you know, schooling and licensing and credentials bring a
Dr. Tisdale, you're breaking up. Is that just me or is that everybody? Is he breaking up?
He looks like he's breaking up.
Okay. Let me give him 1, 2, 3, 4. Let me this question before we close out. What percentage of your patients deal with actual like physical pain as either a cause or effect to their mental health condition? I did want to chime in one more question, and then I'll bring in Dr. Tisdale if he comes back in. But what percentage of your patients deal with physical pain as either a cause or an effect of their mental health condition. The reason why I'm asking this is because in chiropractic, we learn about there's something called the psychosomatic response, meaning that there's something going on in the mind and there's a reason why that happens, but it shows up in the muscles. And then that could also happen vice versa. There can be a somatic psycho response, meaning I've got pain here, but now it turns into depression or something like that. So Kelly, I'll let you chime in since I didn't hear you say much on the church talk. So I'm gonna let you talk first, Kelly.
Thanks. So I don't have a good percentage to give you. However, what I can share is that I know from both from personal experience and from client experience, this is real. The pain caused by psychological stress or de-stress, it's real and it's confusing, right? So you go to your PCP, you go to your doctor, and you're, my joints hurt, I'm tired, I have these physical symptoms, and the doctor does a whole bunch of tests and you're fine. They tell you, yeah, go see a therapist, nothing's wrong with you. And that can be such a huge turnoff. Whereas it could be phrased as something like, we did all these physical tests, you were in good health, but I believe that your pain is real. Here's what you can try next.
That is awesome, Kelly. Mm-hmm. Wow. So, Kelly, what you just said right there is awesome. Yep.
Rather than, calling you crazy, using that word, there's nothing wrong, fix it. You're making this up. Phrasing it as, I believe you, and mental stress can come out through the body. It's validating. So I think that's a shift that I would love to see doctors taking in sort of presenting that approach to clients.
And and I will tell you from my personal experience that I've been practicing 13 years in the state of Maryland, and I have had, I don't want to say once a month, but it happens very often where I have patients break down crying, because chiropractors, we look for different things than maybe a medical doctor. Like, somebody has, hey, I've got this pain and it's really bothering me, it's in my shoulders and it's killing me at night. So they go to their PCP or they go to a specialist and they do MRI, they do blood work, they do x-rays, and everything comes back normal, right? And usually the patients just kind of get brushed off and they say, oh, well, you know what? They don't really get that acknowledgement from their doctor. And the reason I'm bringing that up and the way I know is because when I at least acknowledge and I say, okay, well, you know what? I did find something that we can work on from a chiropractic standpoint, because this is misaligned or this is subluxated. The patients usually, the reaction that I get and how I know they were really impacted by their medical doctor, they usually start to cry. And it hurts me that people, they went for, it's not like they were the undertreated like Dr. Tisdale was talking about. They went for help. They went to a trusted health professional, but and I don't know, it's because of and that's another talk, maybe because they're getting, just because of the issues going on in healthcare, there's more volume, there's less quality visits, and people feel like they're being rushed. And that's also one of the reasons why some of the PCP visits, primary care physician visits, are actually going down, even with the advent of telehealth and all of that stuff, because people, maybe sometimes it's either the high cost of healthcare. So there's a lot of reasons for that. But from the population of people that actually go, and then they get brushed off because all of the tests were quote unquote, negative. It hurts people when doctors don't say that sentence. So that you just said right there, Kelly. So I hope there are health professionals that were watching or that see clips of this, and they just see how you phrase it to say, hey, look, you know what? We didn't find anything, but that doesn't mean your pain is not real. Just saying something like that to acknowledge there might be something there, that opens the door for mental health. And that opens the door to send to people like you guys. So that's awesome. Dr. Tisdale, I'm sorry that you cut out. I switched it to pain and mental health, but if you wanted to finish your thought, and then Dion, and then I'll have you guys just kind of start wrapping up.
Nope, but the main thing that I just wanted to agree with Dion, is just the fact that we must utilize, the skills, along with the practice to bring the alignment for the best outcome. And I think, when we're thinking about mental health and, substance abuse as a whole, it's professionals out there to meet those needs. So let's just allow them to be the tool to get to get the help that's needed and required. So
that's awesome. That is awesome. So what I want to do, let's do a little session. Let's just say somebody, maybe they didn't, they maybe had a little too much fear, maybe too much anxiety, or maybe just didn't feel like it was right to kind of type their personal question in there in the chat room. So that's totally fine. I'm hoping people will see clips of this and all of that in the future, right? So let's start with Dion, then I'll go with Kelly. I'll probably end with Dr. Tisdale. So real quick, final advice for the audience, and I want you to act like or I don't want to say ideal patient, but your typical patient, a typical person that comes to see you, right? So Dion, maybe a middle-aged person going through stress, a whole lot of stuff going on, job changes. First they wanted to work from home, now they're working more hours. Now they're talking about coming back, but they don't know if they're ready to come back and all of this. They've got to deal with the kids, right? So what's your final advice for a typical client, and what's your final advice for the audience?
So first, I don't even know if I would have a per se typical client, because I see people from
such a broad
range presenting with a number of different issues. But let's just say I will say information for a client new to the therapy experience. So if you are considering, this is kind of joint, I'm kind of going to combine them together. If you have been challenged and struggling, mentally, emotionally, and you have been considering counseling or therapy for a while and been encouraged by a friend or family member, give it a try. What you can expect in the first session, a licensed professional will do a thorough evaluation with you to assess you, to get some information from you. He or she will talk with you about the course of therapy and what will occur, what to expect. Ideally, one of the things that I will do in my practice is, after the first session, I'll sit down with the client, and both of us collectively develop a treatment plan and look at the particulars of what we're going to work on in therapy or in session. So if you've been having trouble during this 2-year period that we've been in this pandemic, and we're in the process of coming out of it, you've been affected, you've dealt with anxiety, anger, depression, trauma, etc. It is beneficial for you to reach out to a licensed mental health practitioner to get supportive talk therapy, to work through a lot of that material. You can improve, you can get help, you can get better, push past the stigma, the hesitation. And there's a number of places like psychologytoday.com that you can look up people. If you are in the African American community and you would like a Black male or female, you can look on websites like therapy for blackwomen.org and therapy for Black men as well. So just be encouraged and know that everyone has challenges, and we all are on a spectrum of mental health, and you can improve in your mental health. Your mental health matters, and there is no health without mental health.
All right. I almost said amen. All right, brother. All right, Miss Kelly. Miss Kelly, so you're talking to, and I've dealt with, of course, I'm not in mental health, but I've got plenty of college students as patients, and some, they tried college last year, didn't like it. They weren't able to, communicate. They had all these issues. They flunked out because they were just, so stressed. It was so different. It wasn't a typical college year that they were looking for all their life. Or the high school graduates that are about to enter into college, and they don't know what to expect. They don't know if if they're going to be on campus. They don't know if it's going to be hybrid. This is a brand new phase in their life. Talk to that person. And what's your words of advice for that for that age group and what they're going through right now?
Yeah. So my advice would be that no issue is too small. I think that age group especially does a lot of comparing. Well, that person's parents are divorced, their dad died of COVID, there's a lot of comparison. Therapy can help anybody anywhere on that spectrum. Whether your pet passed away and you're really having a hard time, whether you're nervous about going away to school, those are all, any reason is a good reason to reach out to a therapist. We use the term in the field, like worried well. You can be having the time of your life and still maybe you need some coping strategies for when work gets stressful. There's always something you can get. And so I think, don't compare yourself to others. Don't do that. If you feel like you want to talk to someone, you just want to try it out, call us. Absolutely. Find somebody who you want to talk to, and we're not going to keep you coming back for your weeks and weeks and months if you're doing pretty good, but make that connection. Like a checkup, right? Check in, see how you're doing, have someone kind of do that assessment and see if there are areas you can improve on.
Wow, that's awesome. That's awesome. Dr. Tisdale, I got about 2 more minutes and then we'll wrap up with just contact information for you guys in case anybody needs to reach out to you. But what is, typical, I don't want to say typical as if it's average or to make light of it, but let's just say there's somebody out there, they're watching this on YouTube, maybe it's going to be on the internet, so maybe a year from now, and they've been in, NA, AA, they've been in all these programs, they stopped, they were sober, kept falling off the horse and kept falling. Now they're court ordered to see you for the, 5th time. What's going to make this time different, Dr. Tisdale? Why should I even bother to see you? Or
the first thing is,
let me say like,
the reality is that evidently, especially if you court ordered, there's definitely something's going on that you've been mandated. And that's the reality. We don't want people to be mandated to get the care that they need. We want at will situation because it works a little bit better. That means that you're obligated to come see me. You're obligated to leave a urine in all of those particular situations, which means your problem is maximized versus minimize it. And that's the goal of therapy. That's the goal of supported services. That's to make your better quality of life. So when we think about NA and AA, all those are resources and tools that support the issue. But let's just break down the issue. Let's just get the care that we need to get the support that we need, where we can get a better outcome for us and all the people that we love.
Awesome.
So let's just not, that's recovery. So let's just absolutely. And it may be something that you could be dealing with the rest of your life.
Wow.
Yep.
Wow. And you got to find out what are some good coping strategies for that. So, you know what? That's awesome.
Absolutely.
So in other words, deal with the prevention of the aspect. Don't just wait till you keep getting court ordered. Let's deal with the prevention part of it. And let's deal with the root cause. So, folks, thank you so much for joining us. I know we met a little bit later. I had a feeling we would because this is such a potent topic and we probably could have spoken another hour. Thank you all for your comments. Thank you all for just joining in. Our next community, a couple of announcements real quick. The next Community Health Live conversation, I have an idea of the health professionals that I want to bring on, but it's not going to be until August. Why? I have a lot of things personally going on, and I got to cope. I got to make sure I'm not, stressing myself out. Absolutely. Or my wife, right? Or my kids. So I want to pick this conversation back up, and it might be a different conversation, but that'll be in August 24th. The 4th Tuesday in August will be our next live if you want to put that on your calendar. The reason what's going to be taking us so long is because we actually we are moving into a new facility. We're moving into a new building, and that is a Harford County location. We're moving into a new location, and there's also a lot of other things going on. I'm writing a book. I'm in the process of writing a book, and all of you are going to be in it. Just kidding. Well, I'm definitely going to use and take pieces of this conversation. And this was just an amazing talk. And I thank you all for your time and your donation of your time, because you're all healthcare professionals. So, Mr. Dion, how can they get in touch with you if they're in the Baltimore Metro, or even if it's mental health? Because I think any one of you are accessible through mental health. So how can somebody get in touch with your office?
Sure. So a few ways. So you can go to my website, which is www.djb. That's Derek Joy Boy. Yeah, there we go. www.djbtherapeuticsolutions.com. The practice line is 443-228-8754. I do have an IG practice page where I post therapeutic tools, tips, videos, infograms, etc. weekly. And that IG page is the_DMV therapist, the underscore DMV therapist. And lastly, if you want to hear more of my voice, you can check out my podcast on Spotify as well as Apple, the Lost and Found podcast.
Awesome. Awesome. Miss Kelly, thank you so much for your time. How can, if somebody is just like, you know what, you just touched my heart and I think I found the right therapist, how can they get in touch with you?
So I'm pretty basic at this point. You can find me on Psychology Today. You can just search my name. I'm in there. I'm doing all teletherapy right now, so feel free to look me up there. You don't even have to call. You can just send a request for a consultation, and we can connect that way.
Awesome.
Yeah.
Awesome. Dr. Tisdale, how can they find you?
Absolutely. I can be reached at jtisdale@jhhc.com. It's a secure email, so anybody want to get in contact, it's a great tool to collab. Absolutely.
That's perfect. That's perfect. That's perfect. And last but not least, I'm your host, Dr. Roch Harold. The website of my practice is www.msiwc.com. Dr. Roch DC is my IG. And thank you so much for watching. And I'm sorry, Dr._Roch DC, Dr._Roch DC, or msiwc.com for more information on how we help people in the practice. And thank you all for watching. Stay tuned for the next one. And guys, thank you so much for your time. Guys and gal, thank you so much for your time. Thank you all. God bless you all. Have a great night.
Thank you. You too.
Good night. Good night.
All right.